So hi everyone, welcome to another of our Facebook Lives. My name is Zoe Clark, I'm Self-Management Programme Officer here at NASS, and today I'm joined by Garry Williams, who is our Helpline and Branch Support Officer. So welcome Garry, thanks for joining.
Thank you, it's a pleasure to be here.
So this session is, sorry I think I'm a little bit delayed on my internet there, so sorry if I spoke over you a little bit.
No, that's fine. That's fine.
Perfect. So today we're going to be talking all about disability benefits, which is an area of expertise for Garry. And I think quite a lot of people watching will probably have spoken to Garry on the helpline or emailed with him. So hopefully it'll be nice to get him out in front of the camera rather than behind the screen.
Okay.
So the video will stay on our page afterwards, so you can catch up afterwards. So rest assured if you can't join us for the whole stream. And also we've popped some information in the video description as well. So if you want to contact Garry after the session, we've got a line number and also Garry's email address. So do feel free to contact him for some more personalised advice and to have a chat privately as well. Obviously, I'll start just by saying that obviously it can be a bit of a sensitive topic as well. So hopefully we'll be discussing this in a sensitive and sort of approachable way as well. But please do pop any questions or comments in the comment box and I'll be able to ask Garry those questions as we go along. So first, Garry, do you want to tell us a little bit about yourself and the work that you do for NASS?
Sure. Thanks, Zoe. I'm really looking forward to this. I started working at NASS in May 2018, so it's 2.5 years ago. And when I started, I didn't really know very much about AS or Axial SpA at all. I think I was recruited for my experience in advice work and also telephone counselling. And my previous experience was I had a lot of experience working for the Citizens Advice Bureau as a benefits advisor, but also as a support worker with victim support. And in the last 2.5 years, my role is Helpline and Branch Support Officer, but increasing demand has meant that more and more time is taken up with helping people with supporting letters for their benefit claims, which is a real pleasure for me. Yeah, it's really rewarding work.
Absolutely, and even just on the couple of posts we did just to advertise this session, it was really nice seeing all the comments coming in from the people who you've helped. You've helped lots of people over the years and getting busier and busier. Yeah,
it just feels like a very sort of specific and practical way to help people, and you know, it's well known that you know, disability can be associated with increased levels of poverty for a wide range of reasons, and so being able to help people in a very specific, practical way is really rewarding.
I bet, yeah. And I mean, we know that disability benefits in general are quite underclaimed. Is there any sort of common reasons you've come across for that?
I think just anecdotally from my experience and what you know I know from the sector, I think any health-related and age-related benefits are underclaimed for a range of reasons. So there is still a stigma attached to claiming benefits. A lot of people are put off by the bureaucratic nature of the process, the forms, especially for PIP. You know, absolutely horrendous when you first look at them. And also, I think there's issues with a condition like AS. It's really important to have a positive mental attitude and to engage with the condition, and therefore sort of a lot of people have issues with thinking of themselves as disabled sometimes, and also having to focus, you know, to explain how their disability affects them, having to focus on the negative, so much on the negative side of it. So, I hope that that's something that I help with, because, you know, I try to deal with people sensitively and to, you know, reassure them. And, you know, I always try and balance, you know, the negative side of this sort of work with acknowledging how they have adapted to and overcome their disability as well, which can sometimes go against them if they're trying to explain, you know, why they should. Because the other issue that people feel uncomfortable with is feeling that they're having to justify themselves or justify why they should get this, when in reality they're entitled to it by law, you know.
Absolutely. I think it's something quite difficult when you're first looking at navigating the whole system and looking at what you're entitled to. And I think particularly with a condition like AS, where it affects people so differently and the symptoms can fluctuate. You know, one day you can be having quite a good day and another day a bad day. It's quite difficult to look at the support that's available and knowing what you should apply for and sort of how you can get around that. And certainly, as you say, I think as well, many disabilities make you sort of a problem solver, and it's something where actually you look at things of how do I get around it, whereas for the applications you need to be really honest about the problems that you do have to solve, so not just sort of putting that positive
and
spin on
sometimes
it.
that involves acknowledging it to yourself as well, which you know, I'm constantly amazed by the levels of pain and fatigue that people with this condition live with and, you know, overcome, and, you know, to lead their lives. And this is something I feel strongly about, that it's important that, you know, I can help them to get this money that they're entitled to.
Absolutely. And I know a lot of your work is very focused and you focus a lot on in particular. Is there any particular reason why it sort of has ended up going down this avenue more for people with AS?
Well, when I started working for NASS, we already provided a service, an ad hoc service, where my colleague Sally in particular, but other people had done sort of supporting letters, which had helped people with their benefit applications. But when I came to NASS, it's part of my role, but because of my experience, I was able to build on that and offer that more in a broader way. And it's just, we haven't particularly gone out of the way to promote it or publicize it. It's been by word of mouth. It's just over time the demand is there, and I'm certain that even in terms of people with AS, we're only dealing with the tip of the ice, because it is just me now. We are only dealing with the tip of the iceberg, but it is a service that, you know, it's much needed by people out there. And just to sort of explain what it is actually I do, it is very specific and it is very focused. I talked about my experience as a benefits advisor, so I wouldn't describe myself currently as a benefits advisor, because I'm not across or up to date with all the rules and regulations that govern all the different benefits there are out there, which is why when people get in touch with me, I will always advise them, if they want to check their total benefit entitlement, to contact an agency like the Citizens Advice Bureau or a similar advice agency where there will be benefits advisors. Or there's a couple of really good websites. One's called Turn to Us and Turn #2. I think you're putting the information up there, aren't you? And Benefits and Work, where you can actually, they have assessment tools that you can complete yourself, or, you know, check what your likely entitlement to PIP might be. But what I'm doing is actually what I've developed, supporting letters, which are based around a template that starts by explaining what, in general terms, what AS is, something about AS, because the people at the DWP won't necessarily know what the condition is. And also with the information that you're able to give me, I'm able to complete a letter that really, I describe it as an impact statement almost. Is a description of how your disability affects you on a day-to-day basis, what it's like to live with a condition. And the reason I'm able to do that is because, you know, I am just dealing with generally one condition, but so I'm able to describe the condition in general terms, but it's important then that we get the specific information that only you as an individual can provide. So people often ask me, does it matter if I can't get a letter from my doctor or my rheumatologist? And it is really important. It's always important to give them as much information as you can, and to, if you can get letters from those healthcare professionals, do. But it's not the essential, or it's not the end of the world if you can't, because basically your doctors can, it's important that your doctors can confirm what your condition is, what your treatment is, your prognosis, all the medical side of things, but they obviously don't live with you. So they don't know how you cope with, on a day-to-day basis, with washing, dressing, using the toilet, getting out of bed, those kind of things. And so I see my role very much, because of my understanding of the criteria that they use and the way they look at how you qualify for the benefit. I see my role as very much as being able to facilitating people, enabling people to express their needs effectively, by which I mean it's not just about whether they're articulate or not, because I help a lot of very articulate people, but it's about knowing what the criteria are and the specific, what they're actually looking for, so I can tailor what the letter, not just for the individual person, but actually for the requirements of the assessors. So, and I think that's why they're proving so successful.
Yeah, because sorry.
Well, I was going to say, it's almost like making it easy for them to make the right decision, or making it as difficult as possible for them to make the wrong decision, just by spelling it out in a specific way. And that's because of my experience, basically.
Absolutely. I think that's so important and so helpful. And certainly I think as well, because you are able to say, how do each of these things affect you, and what adaptations do you have to make in order to then create that impact statement. I think it makes the person applying also really analyze things and look at how they have adapted, because it's very easy to make these adaptations to your daily living or your day-to-day activities, and not really realize that you've made them, or not really think to mention them as well, whereas what we need to mention in order to sort of speak their language in the application as well.
And so I sort of know I know the terminology, if you like, so which the average person isn't going to know. So a lot of people might be confused on the forms. I always say to people when they're completing the forms to take their time with it, do it in 2 or 3 goes, maybe if they're not getting help from an advice agency, have someone who knows them well just to assist them or back them up when they're filling in the form. But if it's especially important, if they are doing it themselves, to take that time to explain as fully as possible, how, with each of the criteria, with each of the descriptors, the daily living activities and the mobility descriptors, how they're affected. And people, I think, get confused because they're asked to explain what help they need with a specific activity. And you don't actually have to qualify for it. You don't actually have to be getting any help, but you have to demonstrate that you need help. And so a lot of people might think, well, actually, I do get dressed, I do get up, I go, I prepare a meal, so don't need any help, so I don't qualify for this. But what they don't realize is that when assessing whether you're entitled to this benefit, what they're supposed to look at is whether you can do something effectively or properly in a reasonable time, safely, and without causing any harm or making your condition worse or leaving you exhausted. So there's a whole range of, and repeatedly as well, there's other factors as well. So for someone like me who knows about that, I can tailor how people are answering these questions, because a lot of people, I think, get turned down at the initial claim stage, because they either don't give them enough information, or the information they give them isn't necessarily relevant, or to the benefit that they're applying for. I always say to people, if you're unsure, always err on the side of giving them too much information rather than not enough. But having said that, I think it is helpful to have this sort of letter which focuses on, so the assessor looking at it can go, if you like, that's what I believe. I don't speak to anyone at the DWP, but I do know that, you know, the amount of feedback I've had from people saying that the letter made a huge difference, and it may only be that it gave them the confidence to push it forward, because what sadly happens is there are a lot of issues with the way the benefit system is working at the moment. And I mean, NASS is part of the Disability Benefits Consortium, which is a group of charities who are campaigning to on this issue. So we do, you know, we contribute to their campaigns on that. And you can look them up online, Disability Benefits Consortium. They're really interesting, and if you want to know more about that side of things, then do. And a lot of people either are put off applying what they're entitled to, or give up because of, you know, the nature of the system, the red tape involved. A lot of people get turned down, and the next stage then is to take it to mandatory reconsideration, or a review as they used to be called, which just means another administrator looks at the paperwork. And 1 in 5 people will get a successful decision then. But even then, that's a stage you have to go through to appeal. And currently, the figures for people at appeal is that even without representation, 75% of people are successful at appeal.
Gosh, I didn't realise.
Which is shocking. Yeah, which is shocking. I mean, you know, that's I'm not going to be political here, but it's a shocking indictment of the system and the way it works and the initial decision-making process. So, and the problem with that at the moment is even before COVID, is they were taking longer and longer to process these appeals. So people were, I think they're getting slightly better now, actually, but people are still waiting months. But if you are successful at appeal, your award is backdated. Yeah, so I always encourage people to take it forward, even though it can be quite intimidating and stressful without support.
Yeah, and you did mention a couple of organisations sort of a little bit earlier on in the conversation. So for the actual application forms and things like that, although you're unable to help with that, there are lots, we've linked to them in the video description, and we have information on our website as well. So there are lots of charities that can.
Well, a lot of people just don't know what they might be able to get. So I would encourage them to use the benefit assessment tools that on Turn to Us or on Benefits and Work. If you want help with filling in the forms, then your best bet is to approach a local advice agency, either Citizens Advice or there are lots of local disability rights groups around the country. And some local authorities still have welfare rights departments, which might be able to do it for you. But
there are some companies, sorry.
I was saying, if you don't get,
you can use, can't you?
There are a few law firms and solicitors that will do it for you for a fee, and I would exercise caution and say it's not usually necessary. I mean, we're usually talking about, you know, no win, no fee firms. If they ask you to pay a fee in advance, then just don't steer clear of them. But you shouldn't need to go through them, except like with private medicine. Maybe if you pay, you might not have to wait so long, because a lot of the advice agencies, with the way the world is at the moment, the way it's been the last few years, are genuinely overwhelmed with demand, which is one of the reasons it's a pleasure for me to be able to do this work for people with AS, is because I do know I'm able to work specifically with this patient group and I know that there is good advice out there, alternative sources of advice, but they may have to wait 3 months before they can get an appointment with someone to get the advice that they need. So, yeah.
Which is a long time if you're struggling, definitely.
Yeah. I don't think 3 months. Yeah, probably 2 or 3 weeks is more typical, but I still think it's helpful to be dealing with. So, for instance, someone with AS can talk to NASS, and where the charity that works with AS and understands AS, and so we can provide that tailored service. Yeah,
absolutely. And just from the few months of working with you, I know we sort of transfer calls between us from, I may speak to someone who's struggling with a flare up of their condition. I'm giving advice on that, and then I'm able to pass them over to you to help with that, and vice versa as well. So it's not just the disability benefits advice and help with the supporting evidence, but even just help on kind of managing the condition, and particularly if the application process is throwing up a lot of sort of stress and anxiety related to the condition, we can provide that support too.
Yeah, and it does. I mean, it does. It causes a lot of stress and distress to some very vulnerable disabled people, and the system is a blunt instrument, really, to be honest. And I do encourage anyone who feels strongly enough about it to write to their MP or sign a petition, just to do something to help, push this up the agenda. And there are, to be fair, there are a lot of MPs who are supporting us through our all-party parliamentary group and that kind of thing. So, yeah,
absolutely, lots of exciting work going on there.
Yeah.
We've got quite a few people joining us in the comments section. You'll be pleased to know, Garry. I know you can't see them, but I can go through them and bring up anything people have been asking as well. As I expected, we've got a few people thanking you for your hard work with them. And we have had people mentioning that even with a doctor's letter, they weren't able to get access to the help. Is there any advice you'd give regarding that?
I'm not sure what they mean. If they mean that they didn't qualify for the benefit, even with the doctor's letter, as I was saying earlier, that's definitely getting. I mean, I'd be more than happy for them to get in touch with me. As I was saying earlier about the letters that we provide are actually, as I said, impact statements, helping them to describe how they, how they're affected on a day-to-day basis, which is what the assessors for these benefits are looking for. It is important to get medical evidence, but as I said before, your doctor doesn't live with you. Your doctor doesn't know how I don't see you either, so I don't examine you. I'm not medically qualified. It's not a medical document and doesn't in any way claim to be. But so it's phrased, if you read it, the letter when you see it, it's phrased to say, Mr. Mrs. So-and-so informs us that, and we go through. So we're helping you to phrase your statement, if you like, in a way that makes sense to the assessors. And I always finish the letters by saying something like, all of this evidence has been provided to us by so-and-so, and it is consistent with their diagnosis of AS. And on that basis, we support their entitlement to PIP. So just in case, because sometimes people have raised the fact, well, these people haven't seen you. How do they know, what it's like for you? So we phrase it in such a way to say that these are the patient's words. This is the patient's statement. So, yeah.
That's really reassuring that it is saying, it does fit in with what we would expect from the condition as well. And I think as well, the more people who go through the process with that kind of representation, I think then it's even going to increase the awareness of the condition and the impact that it can have, within the system as well.
Yeah, absolutely. I mean, in the time I've been at, I think I've done Spondylitis for about 300 people, maybe 400.
Amazing.
And I mean, I do letters for around a range of issues, so not just benefits. So, but 90%, 80% of it is benefits, and most of that is PIP. I do provide letters for people, supporting letters to explain the condition and how it affects them, for things like applications for blue badge disability parking permits. I've done a few letters for people with housing applications, or applying for grants, or for aids or adaptations at their home, and also related to work. So if people just want something to show to their employer to explain what the condition is and why they might need some help or some flexibility in their work to continue working. So yeah.
That was really helpful. We do also have the employers' guides on the website as well that we can send out to people, or people can download. Yeah.
Absolutely, and they're brilliant. The only thing I was saying about the letter I can do for them is that it's specific to the individual. So, but yeah, the employer's guide on the website is really good as well as a general description. And
we do have some guides to disability that are available, but these are only available to members, aren't they? Because of the way they're produced.
Benefits guides, yeah. We subscribe to Benefits and Work, so we pay a fee to subscribe to them, and we have access to their guides to various benefits. But because for legal copyright reasons, we can send them out, but only to members. That's part of my understanding is that that's part of the contract or agreement with Benefits and Work. So we can send them out to anyone who's a NASS member. So.
And we've got your email address and the helpline number in the video description. So if anyone watching does want to have access to those and you remember, do just get in contact with us.
Yeah, that's absolutely fine. I mean, I do always say when I send them out, the guides are quite detailed and comprehensive. And so I say to people, you know, you should maybe consult a benefits advisor as well, but also, you know, people have fed back to me, oh, this is an awful lot of information. Well, I've sort of said to them, you don't have to read it all, just look at the content in the index and pick out the bits that are relevant to you. So it's not like you have to read the whole thing. The other thing I send out, which I think is really helpful, some people might be familiar with them, but for PIP especially, diaries. So there's a diary template to fill in, and also examples of different versions of the diary around issues like mobility or obesity or fatigue. Because with a condition like AS, it's obviously a fluctuating condition, and so it's good to be able to show how you can show that as evidence if they ask you over a period of time. Something I get asked quite a lot is, not quite a lot, but occasionally I get asked, you know, because I explain in the letter that I do for people what flares are and they tell me how often they have a flare and how long on average it lasts for. And a few people have said to me, well, should I just answer the questions on the claim form as when I'm in flare? Because the other thing with this benefit is they will want to look at how you are most of the time. So just to take a ridiculous extreme example, if you said you have a flare every week and it lasts 3 days and everything is based on you having that flare, then you're not going to qualify. If it lasts 4 days, then you would qualify. But I would say to people to try and describe how they are on a typical average day, which usually isn't when they're in flare. Because the point is that, yes, they're very, very disabled when they're in flare, but they're not sort of running about and jumping out of bed when they're not having a flare either. So the point is because if you just rely on how you are in a flare, then that they will be looking for that. And when you have an assessment, they will question you about that, and they will try and pin you down. To you know, and so you can't just be saying, oh, I'm disabled when I have a flare and I'm not disabled when I don't. Can you still see me? I've got something up on my screen. Sorry.
Yes, can see. Yeah, thank you.
It was just an ad that came up.
Yeah, and certainly I think something you mentioned earlier was the fact that even when people aren't in a flare, you need to make sure the information you provide represents kind of what you can and can't do, because obviously there are some activities people could do, but that would put them into a flare, so they probably don't do it. So even that you can get across in your explanation.
Yeah, exactly. So if doing something or doing it repeatedly, for instance, is likely to cause a flare, then absolutely you should explain that, and that should mean that you score points for that particular activity.
Like, for example, I know for me doing housework, I have to split it up gradually over a long period of time, because if I went and did what sort of someone without AS does in one go, then I know that I would then be, triggering a flare up for quite a while. So I could imagine if I was filling in a form, I'd think, oh no, but I can do the cleaning perfectly fine. But it is because I've made those adaptations and modifications as well.
Yeah. And so much of this is why that's exactly why a lot of people who should be getting it don't get it. It's really important to, especially with a condition like AS, to, I mentioned in the letters usually that people with AS are having to be constantly aware of the effect on their fatigue and their pain levels as well. So, if you so for instance, you mentioned housework, so they don't ask you about housework, but specific things. So if preparing a meal or something, or, for a lot of people, I help find standing or sitting still for more than a few minutes just becomes incredibly painful, and they have to move, so they're not able to concentrate on a particular thing. So it's important to communicate that, which is what I'm helping people to do.
Excellent. We've had a more specific question come in from Joe, who's asking in terms of renewing for PIP. Do you have any advice in terms of the process of renewing PIP? Hopefully we've covered a little bit of this already in terms of how we do the supporting documentation and things.
Yeah. If you're, they will normally award you PIP for a certain period of time, and then they will review your award. So it's a case of the same process again, really, filling in the forms, getting help with that, and I can provide a supporting letter. If you are asking them to review your award because your condition has deteriorated, which you can do after a certain period of time, then it's you have to be more careful, because in theory they can look at the whole award, and they can review the whole award and withdraw or reduce it, as well as increase it. I would say with people with this condition, it's unlikely that they would reduce or withdraw it, and even if they did, you could get it back at appeal. But before you volunteer or ask them to review it, I would get advice, maybe use the PIP test on the sites I've told you about, just to get an idea of whether you might qualify for the addition. So quite often you might have people who are getting low rate mobility component, or standard rate, I should say, and want to apply for the enhanced rate. So that's one I do quite often. So yeah. So just think about it before you ask them. But if they're asking you to reapply, or it's time, they're reviewing your award, then you just have to fill in the forms as usual, and as I said, get help with filling in the forms. And always, people sometimes worry about, should I relate it back to what I told them 2 or 3 years ago? And I always say, no, they want to know what your situation is now. And unfortunately, with a condition like AS, it's unlikely that your conditions improve significantly. So, yeah.
Okay, and we've had a couple of more specific questions in the comments about different personal situations. So obviously we'd advise checking out the links that we've put in the video description in order to see what you would be entitled to. And then once you are looking at applying to anything, do get in contact with Garry with either give us a call on the helpline or send Garry an email directly, and we can help with that process.
Absolutely, yeah, because obviously I can't assess specific situations off the top of my head, but if you email me, or even if I have a chat with you over the phone, I can, look into it for you.
Absolutely. And lots of thank you comments as well for your help over the years, which is lovely to see. I think we have covered everything in terms of the comments and questions that have come in. Is there anything else that we haven't discussed that you wanted to discuss while we've got the time?
I can only think, well, I'm very conscious that I focus so much on PIP because that is 90% of what I do, but I can provide supporting letters, like I said, for a range of other issues as well, including other benefits. So people claiming ESA or universal credit on the grounds of ill health and who have to go through a work capability assessment. And that's not just the same letter. So sometimes people will get a PIP letter and say, oh, can I go and use this for, and they can if they want, but I always prefer to actually do I have a template for each, or I'll design, I'll draw up a template for a specific purpose. So,
yeah, because I imagine the focus is probably slightly different depending on the situation as well. Certainly for Blue Badge, maybe more mobility than.
Yeah. So then you're, they are just, if it's for a Blue Badge, then they are just interested in your mobility difficulty and why you need to park closer to your destination, and you may need more space getting in and out of your vehicle, that sort of thing.
And we've had another couple of questions come in. So Boris asks if PIP is means tested.
No, that's absolutely not. So I usually say to people when they email me to inquire, it is a good benefit to apply for. And I would say most people with AS are likely to qualify for some element of it. It's paid whether or not you are working, and it doesn't affect, and it isn't affected by any other income or savings that you might have, and it's tax-free. I mean, the reason for that is its purpose was to, my belief is that its purpose is to compensate you for the additional costs or reduced income that you incur because of your disability, regardless of your circumstances. So in theory, you could, if you qualified for it, you could claim it if you were a millionaire. So obviously, don't know why you would, but the other reason it's an important benefit to claim as well, it's what's sometimes called a gateway benefit. So if you are on other benefits or on a very low income, then if you qualify for PIP, then you would usually qualify for additional amounts of those income-related benefits. It's almost like it has a slight domino effect to it. It's just qualifying for PIP on its own is taken for these other benefits as accepting that you are disabled.
Okay, and then final question that I can see so far. Obviously, if there's any questions and comments that we've missed, we'll come back and we'll answer them either directly or just drop in the details to get in contact. But Steve's asked about saying his condition's chronic and he's hoping for surgery. How can he get the surgeon on board? So from that, I interpret that as sort of providing evidence possibly for the fact that he's awaiting surgery and things. So I suppose from what we've discussed, I don't know if that would be entirely necessary.
No, if he can get a letter from the surgeon, or even actually just a letter from his GP, just even in terms of providing proof of your condition, I sometimes say to people, a clinic appointment letter is enough. I don't think it's essential, But if he wants to try and get a letter from the surgeon confirming that, because what they will want to do is assess his condition as it is now and as it has been for the previous 12 months. Sorry, my screen's going again. Okay. So sorry, I forgot to remind me of the original question.
So we're talking about with the surgery. So in terms of getting a letter from the GP or an appointment letter, just to kind of clarify that they have the condition. But you said for PIP in particular, they'd be looking at how the condition affects you now and
daily living activities and your walking. So I mean, I'm not saying don't get medical evidence. I mean, you might have to pay for it, but you know, if you get, sometimes I say to people, it's actually probably more valuable to get a letter written by a friend, relative, or carer who knows you really well and explains, you know, their observation of how you're affected on a day-to-day basis. But obviously your rheumatologist and your doctor may well, you know, especially if you've been seeing them a long time, will know you well and be able to say something useful about how the condition affects you. But it is based on what you describe to them, what you explain to them, and your credibility, basically. So that's why I'm saying, if you rely on your worst days, then you're likely to get questioned about that. And to be, you might, you know, it might help, it might not. So
it's, I imagine it's that difficult thing of being able to answer it, sort of reflecting the fluctuations, really. But from what you've described, there are ways to really do that on the application and in the supporting evidence as well.
Yeah.
Well, that's been a really interesting conversation, and we've had lots of comments coming through. So as I said, the video will stay on the page, and we'll pop it on our website, on our My Life page as well. And we have got the information in terms of getting in contact with you in the description, but your email address is Garry with 2 R's at nass.co.uk. So anybody watching, please do get in contact if you'd like any particular advice.
Absolutely, I'm more than happy to respond. Okay.
Fantastic. Well, thanks very much for joining, Garry. It's been really helpful, and I imagine nice for people who have chatted on the phone or chatted by email to actually see your face. So nice to say hello.
Take your word for that. Thanks a lot, Zoe.
You're welcome. Take care.
Bye-bye.
And thanks everyone for joining.